Hello, my name is Fran, and I'm a patient of Dr. Heimlich here in Scottsdale, Arizona, for 2 months, and I feel good. For the previous 4 years, I did not feel good. My feet, my hands, it started, and it eventually consumed my entire life. I couldn't work. Some days I could barely get out of bed. Walking the stairs was an accomplishment. And now I can move like a person should move. And I take it as a direct result of the intervention and assistance of Dr. Heimlich, and also, you know, the changes that he's introduced, especially into me, especially in my diet. And that would be the best I could do right now. That's it.
And his wife here has noticed a huge difference. You were telling me this morning.
It's pretty amazing. And in a very short period of time, before we came, he slept probably a huge portion of the day, didn't have any energy, didn't have muscle energy to pick things up. His computer, his laptop, he couldn't even pick it up. Couldn't walk. He could be on his feet for more than 10 minutes at a time without having lots of pain and having to have a rest right after. He was extremely limited, basically disabled. Couldn't function. And now it's been, we're just saying it's only been like 2 months, and he's walking, he's comfortable, he's relaxed, he sleeps, he can sneeze. We were saying he couldn't even sneeze before because it hurt so much to sneeze, and now he can breathe and sneeze and walk and go for walks, and we go take our dog now for walks, and he can actually go, whereas before, 2 months ago, he literally couldn't go for a walk.
And what about medications?
Medications?
I was on a lot of medication, and on my own, I've cut back so that the only thing I do now is a foot pain cream as needed, probably about 5-6 times a week now, whereas before that was the one thing that actually helped this year, these past few months, that was new, and I would do that 4 times a day. But now I don't need to. If I'm on my feet too long, things will start to act up, but it's nothing like what it was before.
And the meds you were on before, for years now, he's been on Cymbalta, neuropathy, morphine, what's the other one? Percocets, Ambien to help him sleep at night. What else? I mean, Lyrica.
No. You got neuropathy?
I think you said neuropathy.
No.
Very extreme meds that had loads of side effects. So he also dealt with multiple side effects, so much so that it was almost worse than the pain that he had.
When I first started taking the medication, I stopped after 3 weeks because the side effects of the medication seemed to overwhelm the problem at that time. But within 2 or 3 months, I wound up going back onto the medication because you just can't live like that. I needed something to intervene, but all that was doing was erecting a wall between what was wrong and how I could feel it. Whereas now I feel like instead of just erecting a wall between that, is that I'm slowly correcting the problem from the source.
Exactly.
Now, instead of multiple meds, he's down to almost nothing now.
Yeah.
It's just been in 2 months he's weaned off.
Yeah.
It's pretty amazing. It's just amazing. And we can't say enough about Dr. Heimlich's bedside manner. He's wonderful, very easy to talk to, very relatable, makes you feel comfortable and at ease, and helps you through. He's there always. You can email questions that you have, and he'll get back to you on that. And extremely helpful. And Margie, the staff is just wonderful.
And for those skeptics.
He is a worse skeptic.
I'm a very skeptical person. I think a lot of people are pyramids, silliness, and
Alternative stuff. He
Right.
is not a big believer.
but to me, there's always been a sense that you have to have a connection with your doctor, and if you don't have that, you might as well not be going to see your doctor. And I definitely get a connection, and I get the feeling that he sees you, not just a patient.
Your symptoms. Yeah.
Well, thank you very much for sharing your story. It is an awesome one. Appreciate it.
Certainly is.